According to the Population Reference Bureau, January 2016 fact sheet, aging in the United States, there is a significant shift related to the American elder population demographics as follows. By 2060, the number of Americans ages 65 and older will rise from 46 million to 98 million and represent 24% as opposed to 15% today. By 2060, the older population will be far more ethnically diverse, with non-Hispanic white people representing 54.6% as opposed to 78.3% today. By 2050, there will be a huge increase in the numbers of Americans with Alzheimer's disease, which could nearly triple to 14 million from 5 million today. The larger share of elderly also means that Social Security and Medicare expenditures will increase from a combined 8% of gross domestic product today to 12% by 2050. Many scientific papers, research articles, and systematic reviews attest to the fact that aging is associated with an increase in hospital admissions. This has become a big concern for stakeholders of hospitals and long-term care, especially after the implementation of Patient Protection and Affordable Care Act in June 2009. Since then, the Centers for Medicare and Medicaid Services, CMS, can make hospitals accountable now for their readmission rates. When CMS started implementing this law in 2013, they started publishing in their Hospital Compare website all hospital 30 days readmission rates for patients hospitalized and discharged for acute MI, pneumonia, and heart failure, to therefore make hospital responsible for their reimbursements rates. Federal healthcare reform in the United States is focused on the triple aim of improving care, improving health, and making care more affordable. This can be a big challenge for a small organization like Wyckoff Hospital, a 374-bed teaching hospital, and Buena Vida, a 240-bed long-term and rehab care facility. Programs to improve readmission rates are really needed for these organizations to do well financially and to receive appropriate reimbursement rates. Wyckoff and Buena Vida share the same New York City neighborhood. They are both in Brooklyn, New York. However, Wyckoff is located in the Brooklyn Community District 4 and Buena Vida in the Brooklyn Community District 3. Elderly people 65 years old and older represent 8% of the population in the Bushwick area, where Wyckoff is located. This is in comparison to 10% of the Bedford-Stuyvesant population, where Buena Vida is located. As per NYC Health 2015 Community Health Profiles, Bushwick total population is 134,000 people, whose life expectancy is 78.8 years. The disparity is big compared to Manhattan. Upper East Siders have a life expectancy of 85.9 years and East Harlem of only 77.3 years. These numbers are directly related to poverty, education, access to health care, and many other factors. The leading cause of death in Bushwick are: number 1, health disease; 2, cancer; 3, diabetes; 4, flu and pneumonia; and 5, stroke. For the purpose of this program, long-term care residents at Buena Vida, 65 years old and older, will be the population chosen, excluding those followed by hospice care and those for short-term rehabilitation. The Bushwick population data by race and ethnicity shows that Hispanics represent 65% compared to 20% blacks, 9% white, 5% Asian, and 1% other. This reality is seen at Buena Vida. According to the National Institute of Health, NIH, March 2014, the Partnership for Patients has two goals. 1, reducing hospital-acquired conditions, and 2, reducing readmission rates. The New York Department of Health is also implementing a preventive agenda. It is documented that unmet health needs are indicated by rates of chronic diseases, avoidable emergency department visits and hospitalizations, as well as premature mortality. The implementation of these studies interventions is needed to bring about significant changes in managing chronic conditions at Buena Vida, with goals of keeping the residents in-house rather than transfer them to Wyckoff, improving the quality of life of the residents, and furthermore, lowering unnecessary and costly ED visits and readmissions. These interventions will collaboratively benefit Wyckoff and Buena Vida, keeping the focus on the triple aim.